Good morning, welcome to this webinar. I'm glad that you all can connect to this webinar. We decided finally not to have a live audience because of some restrictions, and I think it's safe enough and will be exactly the same talk. My name is Antoni Trilla. I am a doctor, an epidemiologist working here at the hospital Clínic, and I'm glad also to be a research professor in ISGlobal. The main topic for today's webinar is hopefully to try to explain and probably to answer some questions about this new disease, COVID-19. This is the name, the official name of a new coronavirus infection that is already starting in many places in the world as a new epidemic. And the title summarizes what we want to do today, is what we know and what we don't know, for now, hopefully. Everything starts simply in Wuhan. Wuhan is the capital of Hubei province in China, a highly densely populated city of more than 11 million people, is a very, very powerful transportation hub. It's supposed that close to 1 million people goes in and out from town every day. And as things always happen in epidemiology, there are some things that happen together, and this explains a little bit what is going on in China. At the end of the last year, in the Christmas holidays, with the flu season ongoing in China, a new virus starts running from the city and causing some cases of pneumonia. It's difficult to try to analyze whatever happens at the beginning, but it seems that everything starts in this food, seafood and other kind of meat market, what is called the wet markets in China, where live animals are brought to the market and then sold there. It seems likely, although we cannot prove this at the moment, that probably the virus comes from an outside agency, probably a bat, and then finally end up with an intermediate host, a mammal. We don't know which mammal is. And finally makes the big jump, what we call the spillover. It jumps from the animal to human beings, and this virus has the ability of spread from human to human being, and that's the recipe for an epidemic. This is the electronic photograph of a coronavirus. The name, it came, our fellow microbiologists and virologists say that this is like a crown, and this in Latin is the name corona, crown. Therefore, it's called coronavirus. There are plenty of coronavirus all over the world. In fact, 4 different types of coronavirus are the main cause of common cold. Every winter in Spain, in Italy, in many places in the world, we get a cold, a running nose, and nothing more else. And sometimes this cold is due to a coronavirus. There are other 2 coronavirus well known that has caused outbreaks and epidemics. Back in the year 2002, SARS, the severe acute respiratory syndrome, starts also in China, and for a period of 9 months spread all over the world, and especially hit China and some parts very close to China, but also Canada. And for example, Toronto has been quarantined for a while because of the high number of cases of this coronavirus. Currently, we have another coronavirus that is called MERS coronavirus. MERS stands for Middle East Respiratory Syndrome. It has many things in common with SARS, but it's also a different one. It jumps from camel to camel, and it's located mostly in the Saudi Arabia, in the Arabic Peninsula. From time to time, this coronavirus, MERS coronavirus, also spreads from camels to human and from human to human. But as far as today, it has been mostly located in the Arabic Peninsula, and except from one outbreak in South Korea, in a big Seoul hospital, it doesn't make any much more noise. But this is clearly a different one. It starts in China, the most heavily populated country in the world, the 2nd world economic potency, and that's a very, very different situation. A lot of people traveling in and out, winter, flu season, and another virus starting. And this is the epidemic curve, as we call. First cases start close to the end of past year, 2019, and it starts increasing in January, when it's clear at the moment that the transmission has jumped from animals to humans, and as I mentioned before, from human to human beings. At the end of January, it makes, let's say, a big step in this epidemic. The WHO, the World Health Organization, according to the International Health Regulation, decides that this condition, the outbreak of new coronavirus in China, plus the fact that there are other countries, some of them closely related to China, others are not so closely related to China, that have new outbreaks, and then it decided that fulfills the conditions for being called a public health emergency of international concern. Therefore, on the 30th of January of this year, WHO declares that this is a public health emergency of international concern and warns the world about this is a huge problem in China, but also can spread to other countries, maybe all over the world. Pay attention, be prepared, and follow closely the situation. The virus is currently named by the specialist on naming virus as SARS, is the very same name of the severe acute respiratory syndrome. It makes sense because they are pretty much respiratory syndrome, but it's also coronavirus 2. It's supposed that the first is the coronavirus for SARS, and this is named for the same reason as coronavirus 2. This is the name of the virus. The name of the disease is COVID, as I mentioned, coronavirus infectious disease .19, because it was the year 2019 when it was first identified. This is an RNA virus, it belongs to the family of the beta coronavirus, has a highest similarity with bat coronavirus, therefore it's very likely that the virus stands in the bats all over China, and then from time to time it jumps to other species. It looks less similar to the SARS coronavirus, the original one, and also even more distantly related, distantly related to the MERS coronavirus. As we mentioned, where does the virus came from? No conspiracy theories, no high security lab, no US Army, no China's plots to anything. This is a natural virus. It came from the nature, and in the nature there are a lot of viruses that we still don't know that there are out there. This is what we call the virus fair. So a lot of viruses that maybe sometime from time to time they make a jump from their place to human beings, and there will be a new disease. As you probably know, nearly 50% of all new disease, what we call emerging disease over the last maybe 20 or 50 years, are zoonotic disease. So it's disease that starts in animals and they make a jump to human beings. Ebola is like an example. Avian flu is another example. SARS is another example. And this new coronavirus, COVID-19, is also the same history. The intermediate host, probably it's a mammal, but we don't know. The market was closed, was disinfected, all animals were sacrificed, therefore it's very difficult to follow the track back and see exactly which animal or animals had the virus at the beginning of the outbreak. This is what is called the horse-shaped bat. It lives in China, and it's supposed that this is the most likely reservoir of the new coronavirus. Going to basic epidemiology, one of the main data that we know, and it's difficult sometimes to have an exact calculation, so we use always the law of the average. The more likely number that we get is the incubation period. So how long does it take since I was infected until I develop symptoms? And the incubation period is on average from 5 to 7 days. As you see in the curve, most, but not all people has this 5 to 7 days incubation period. Therefore, a few people could have a longer incubation period, up to 14 days, and even a very small proportion of people is likely that they have even longer incubation period. For the purposes of prevention and control, we use the incubation time of 5-7 days. We double it, and this is the 2 weeks incubation period, isolation period, or quarantine period that is used. So twice the average period of the 7 days. It's also very important, it has been a lot of controversial papers and things like that related, when is this disease transmitted? Most of the cases, but not all the cases, are transmitted only when the patient has symptoms. This is the rule, but there are some exceptions to the rule. A limited number of people that we don't know at the time being, but certainly should be very low, maybe it's 1%, maybe it's 2%, maybe it's 3%, could transmit the new coronavirus in the incubation period. That means not having any symptom. What we don't see, we cannot detect, we cannot control. Therefore, this is not a good news if the number of people that is asymptomatic could certainly transmit the disease. Having said that, I go back to the basics. Most, but not all, people who had the disease only is able to transmit the disease when they have symptoms. So therefore, in this disease period. The basic reproductive number, that's a number that we use in order to say at the beginning of an epidemic and without not doing anything and assuming that all the population has no immunity to this new virus, that's probably the situation at the beginning with this new coronavirus, we assume that the basic reproductive number, how many people could a patient infect when it comes to a new location, on average, it's between 1.5, maybe 2.5, and some series even goes up to 3. If the basic reproductive number goes below 1, we will be more able to control the epidemic. So we should do as much as efforts as we can to bring down the reproductive number in the real scenario. That means prevention, control, isolation measures, washing hands, treating the patients, and so forth, in order to split and probably stop some of the change of transmission, and then we will be able, hopefully, to stop at least the big transmission of the disease. How is the new coronavirus transmitted? It's very similar to flu. There have been many comparisons between the new coronavirus or the COVID disease and the flu. There are some similarities, but there are also clear differences. So it's not right to assume that there is just a more dangerous flu or is like the flu. It has something in common with the flu, but not all things are the same. Related to the transmission, it's true that it's mostly transmitted through droplets and contact in a very close or in a very proximate fashion. Then it's very much like the flu. When I talk, when I speak, when I sing, when I cough, when I sneeze, I send some aerosols over there that travel in the air for a short distance, probably 1.5, maybe 2 meters, and then just drop down to the floor or to the table or to whatever the place is. And this is the main route of transmission. First, a person very close to me breathing when I was expelling these aerosols could be infected. Second, if I touch a contaminated surface like the table or whatever without cleaning it, or much likely without washing my hands, then I could handle the virus in a, let's say, in a transient way in my hands, notably in my fingers, and it doesn't happen anything unless you touch your eyes, you touch your nose, you touch your mouth, whether it's a mucosal surface, that the virus can jump from the intact skin to the mucosa and then enters your body and starts a new infection. So first, foremost, more important thing to do, wash your hands as much as possible in the correct way of washing your hands and clean the surfaces. That's the very basic things that could help to stop, at least to decrease the transmission of the virus. We also said that probably we need a prolonged contact, a long time contact. It's difficult to define what means long time, but probably, let's say, an incidental contact, a couple of minutes being with someone, even 10 minutes being close to someone who has the virus is not enough for getting the virus, but certainly living in the same house, traveling in a plane for 3 or 4 hours close to a person who has the virus, or working in a closed space for a couple of hours in a meeting could be a more risky situation for getting the virus, because the contact mostly is a prolonged one. I just show you some images that you can see. This is from the New York Times. People in Wuhan, in the epicenter, in the zero zone of the epidemic, with protection equipment, the mask, the gloves and everything that is needed to be protected. It's very important to protect the healthcare workers. The healthcare workers are in more risk of getting the infection because they are taking care of the patients infected. And second, they are vital in order to overcome this situation. The health system should be, certainly is in China, in a very stressful situation, and we need all the healthcare workers that we have in good health and not with the infection, so we have to be carefully protected. What is the clinical picture of this disease? It's a very simple one. For most of the people, later on I will tell you how often this happens, it's only a fever and maybe a dry cough. So very, very mild symptoms with fever, even from low degree. Not all people had fever, but dry cough, maybe a sore throat. That's also a very, let's say, common symptom during the winter. And when things start to be a little more dangerous is when the patient starts complaining of something related to the lungs. I cannot breathe properly, I feel more tired than usual, I have chest pain, and then you think that maybe something is not going properly well in your lungs and you get pneumonia. That's one of the most common complications of COVID disease, and a few percentage of people who get pneumonia or even without getting pneumonia could develop an adult distress respiratory syndrome, very dangerous situation with all the lungs doesn't function anymore properly, and we have to use mechanical ventilation or even extracorporeal oxygen membrane or oxygenation. How severe is this disease? Fortunately, up to now, everything should be put in context. Up to now, with large number of people, if I'm not mistaken, probably today will be more than 100,000 people infected today. 80%, that's a large percentage of people, are mild cases. Fever, sore throat, dry cough. 14–15% of the cases are severe ones, defined as you have to be admitted in the hospital because your function in the lungs are not properly working well, or you got a pneumonia, and from 3 to 5% of the cases are very severe or critical ones. That means you need to be admitted in the intensive care unit or you get an adult distress respiratory syndrome. This is the main entrance of the Red Cross hospital in Wuhan, in Hubei province. A lot of people waiting to be selected, to be triaged, to be derived. Seems to be people in, let's say, not bad shape. Probably they come walking to the hospital. These are the mild cases. And the mild cases are probably the ones that we don't count very much well at the beginning or in the midst of an outbreak. So probably some of the figures are overestimated because it's much easier to admit people with severe complications and to count more exactly those people with more severe conditions. As you can see back in the photograph, all the people, the healthcare workers, the administrative workers, the physicians, the nurses, everyone who works in the hospital wears this kind of personal protective equipment. But in the same hospital, the Red Cross Wuhan hospital, there are also people who is critically ill. This is an ICU of this hospital with a lot of people in very probably, let's say, unstable condition, very severe condition that needs intubation and mechanical ventilation and other forms of this kind of supportive, very advanced supportive therapy. So although for most of the people this, and this is a good news, is a mild disease, for some of them could be a very severe disease. The question that follows is who is at most risk of developing these more severe forms of disease. Again, this is not an absolute number. There will be always someone who doesn't fulfill this condition, but most, but not all, of the people who get this very severe or even critical form of disease are aged more than 60 years, so I am one of the members of this high-risk group, more than 60 years. The other one is I get some lung disease, chronic or obstructive pulmonary disease, I'm a heavy smoker, or things like that. And the other ones are a mix of the very common on a daily basis situations that people who had lower immune defenses, like people with diabetes, with people with renal failure, people with cardiovascular disease is also a very powerful high risk factor. But again, there will be some young people, perfectly healthy, who can develop the severe form of the disease, but most will fulfill or will fall down on these of the high risk groups. The next thing is this is clearly a very highly lethal disease, so how many people die on average? On average, we have different numbers that probably will be adjusting over time. Taking into account all China, that will be probably 98–97% of all cases at the time now, at the time it's on China, that will be an overall case fatality rate of 2–3%. That's not very high, fortunately, but if you take out the Hubei province and Wuhan, where 75% of the China cases are located in Hubei province and Wuhan, the lethality rate, the case fatality ratio for the rest of China goes down below 1%. In fact, it's 0.7%. And it's pretty much the lethality rate outside China. So some people trying to make some mathematical models and things like that believe that probably the real, if we can see the real, because we don't know which is the true case fatality ratio, will be closer to 1. Probably. We don't know yet. On the graph, you see what the difference are in the case fatality rate, so the mortality rate, depending on your age. If you are a young one, younger than 50 years, there is a very, very small percentage of people who die, even the children or adolescents, young people less than 19 years has a fatality rate of 0.2. But starting on 60 years up to 70 years, that will be 3 point something. From 70 to 80 years, it will be 8 point something, and you are aged over 80 years, then probably your likelihood of dying is very, very, very high compared to the others, close to 15%. This is another graph from the New York Times. It's a very good one at the beginning of the epidemic, and I will try to show you how we compare, or how is let's say the way that we compare things, taking to some outlook or perspective. This is the lethality rate on a logarithmical scale, so that will be 1 per 1,000, that will be 1 per 100, that will be 10 per 100, that will be 100% mortality rate. And this is, on average, the same of the basic reproductive number. How contagious is this disease? And for example, we get here measles. That's one of the most contagious infectious disease that has on average a reproductive number of 15. This is what we have the range of the new coronavirus. Probably, if we admit that the lethality rate, the case fatality rate will fall closely to 1%, that will be over there. That's a good thing. But look that the mortality rate for seasonal flu, the overall mortality rate for seasonal flu compared to the overall mortality rate for COVID-19, mortality rate for COVID-19 is 10 times higher than the average case fatality ratio for seasonal flu. It's a very low mortality rate, true, but it's 10 times higher. That means if we get an epidemic of COVID-19, the healthcare system, the ICUs, will suffer a surge in the number of patients that had to be admitted, and maybe we will face some shortage of people, of healthcare workers, of mechanical ventilations, whatever it is. So we have still to do as much as efforts as we can to either, hopefully, stop the epidemic, or at least make the epidemic progress very slowly in order to avoid these peaks of very heavy burden and pressure over the healthcare system. The diagnosis at the time being, it's pretty much simple and straightforward. It seems that we have to get a nasal or throat swab, and then we send to the lab. In the lab, they perform a real-time PCR, and they identify in 5–6 hours if there is enough data to say that it is a positive one for this new coronavirus, or is a negative test for this new coronavirus. Under the actual circumstances in Spain, the test, in order to be performed, has to be approved by the public health authority. So we cannot test everyone. So we have to follow the protocols, to follow the guidelines, and if the patient is believed that they have enough risk to be tested, then they allow us to do the test. If not, the patient at the time being is not tested. We don't have treatment, specific treatment for this disease at the time being. There are a lot of people looking for new antiviral drugs or other drugs that could help in finding a new treatment for this disease, so we have to deal with symptomatic treatment, and in the severe cases also with symptomatic and support, even advanced support at the ICU treatment. And there is a lot of clinical trials going on. When we have an epidemic, it's difficult to conduct a clinical trial. Clinical trial very stringent in the way you have to conduct it, but from time to time it's the only way to prove that some antiviral drug is better than the other or works is doing a randomized clinical trial. This is done not actually in China. They are using also different combination of antiviral drugs that has been used formerly for HIV infections, like lopinavir, ritonavir, and also a new drug that has been tested for Ebola and for other viruses, but has not been approved. It's an experimental drug that the name is remdesivir. There are also other drugs, chloroquine and interferon beta and things like that, but all with anecdotal data, not still tested in a randomized clinical trial. What about the vaccine? The vaccine also, there are many labs in the world and a lot of people working with public-private partnerships and private industry and universities trying to find out if there is some candidates to become the vaccine for the new coronavirus. We don't know what's the natural immunity for this virus. We assume that if this new coronavirus behaves like other coronavirus, that will be a short-lived natural immunity, maybe 6 months, maybe up to 1 year, but no longer. That's not good news, because in the event that we get a vaccine, we don't know if we have to use the vaccine, let's say like the flu vaccine. Every year we have to vaccinate again the people because the immunity only lasts 1 year. But this is actually absolutely an speculation. It's only related to how other coronavirus behave. Also, if there is some candidate to become a vaccine, it has to go clearly into clinical trials in order to prove that it's a safe vaccine. We cannot use a vaccine that has not proved that it's safe enough, and that it has some efficacy and probably will be useful on the field. Taking into account all these things, we probably will work with the hypothesis that we will not have a vaccine, if we had one, up to 1 or 1.5 years from now on. So this very first wave of the epidemic we'll have to face without treatment and without vaccine. What about the situation in order to understand what happens? China, as I mentioned, the largest country in the world, highly populated, very big cities, people traveling very easy in and out from China. It's the beginning of the epidemic, but nowadays it's, I don't know, maybe it will be today something like 60 or close to 60 or even more than 60 countries with imported cases, and some of them with outbreaks or even epidemics of this new coronavirus, and with change of transmissions that could not be linked to an imported case. That means autochthonous or on-site transmission. China has done, at the beginning, probably the release of information is not good enough. I cannot further comment on that, that probably it's true, but it's also true that taking into account the structure and the fact that China is not a democratic country and is very powerful in order to say to their citizens what they have to do and what they don't have to do, and also Chinese people has a strong feeling of being together and they work together to fight this epidemic. That will be extraordinary measures, some of them even unthinkable for democratic societies like ours, but they start having controls in the roads, they lock big cities like Wuhan, 11 million people locked inside a city for 3 weeks or more, and people is not able to come back home or even to get out from the city. They also ban public transportation, they track people by their cellular phones, and they know exactly where the people is moving to tracing contacts. They put a huge effort in trying to use what we call non-pharmaceutical measures, that the classic epidemiology measures to control epidemics: quarantine, isolation, movement restriction, closing of public gatherings, banning schools and things like that. This is the only thing that we can do in order to stop the transmission when there is an ongoing and fast transmission like in China. And also it's quite important that we have to keep in mind that the world at the time being is very depending one country from another, and we are not even conscious that something that we use today could be produced in China, and this China stops all production of things because of the epidemic. Now it's beginning to restart normal operations. For example, face masks are mostly produced in China. We don't have enough face masks at the time being. If we don't have enough face masks and China does not produce enough face masks, we will be in a shortage of face masks in Europe and in other places. The same for some drugs and the same for many other things. So we have to be careful about how much connected and dependent one from the others is the world when something happens that stops the ability for us for getting, for example, protective equipment. Also, let me make let's say a small note of humor. The Chinese people also find ways to fabricate their own personal protective equipment, like this child that wears correctly a face mask but adds an empty bottle in order to be protected from the virus. Also, China, after having been hit with the epidemic, decided to show how powerful is such a country, and it makes things that looks absolutely impossible for us. Building a 1,000 hospital in a couple of weeks, and staffing this hospital with hundreds or thousands of physicians and nurses also in 1 week. It was, as you see, live on TV, a lot of people making the hospital. The hospital was finally made. It's fully functioning. In fact, there are 2 of them in Wuhan. But also, they decided some other measures that all measures are questionable in a public health crisis. Some of them work, some of them doesn't work, and it's always difficult to make a decision. But for example, this is the one of the biggest sports centers in Wuhan, that was, let's say, changed in order to isolate people, get people out from home and sending the people to the sports center. But here, the control of infection, it doesn't seem to be quite good. The beds are very close, there is no individual room, so you never know. Some things are good, some things are not so good. If they work, fine. If they don't work, you will be blamed for that. So you have to be very careful when you make a decision. One of the biggest projects of the Chinese government under President Xi Jinping is what is called the Belt and Road Initiative. The Chinese people is building motorways, ports, airports in order to restore the basic concept of the Silk Road. And that means that in the coming years, China will be easily and very fastly connected to all the world. And that means that it's very good probably for trade and things like that, but in the event that there is another epidemic starting in China, they will be even spreading faster. So everything has its downside. Probably the Silk and Road Initiative is a very good one, but China must control also very basic things, like, for example, the wet market. So they have to improve clearly the hygiene and the safety of the food that they sell on the wet markets. This is the current situation. The total number of cases outside China is climbing, and there are a few countries responsible for this increase in the total number of cases. Also, there are very bad examples of infection control. This is the Prince Diamond cruise ship that was docked in Yokohama, and with, I believe, more than 600 or 700 people testing positive day after day, because they were quarantined inside the cruise ship without, it seems, the proper infection control measures at the beginning. But international travel, international trade is nowadays world, so we live in this world. We have to accept that it has very positive things, but it has from time to time also very negative things. We are all connected, all interrelated. It's very easy to travel from one side to the world to the other in 18 hours, a couple of connecting flights, so you can brought some virus or another kind of microorganism from a distant place of the world here to Barcelona, to Madrid, to Paris, to London, to whatever it is in a few hours. And this is what happens to us a couple of weeks ago, coming from Italy, as you probably will know. And therefore, although we look at China, the number of cases that start the current situation in Spain, most, but not all, certainly, are related to Italy. And in Italy, that is a very powerful country with a good health system and things like that, they have some epidemic locations. As you can see, that means few villages with a lot of people infected with local transmission that had also been quarantined in very powerful regions of the northern Italy. And therefore, most of the cases in Spain has been imported from Italy, certainly in Barcelona. Barcelona, the largest community of foreign residents here are Italians. And there are a lot of people traveling back and forth from Italy. It's very close, so it's understandable that in Italy they have a problem. Probably they will be sooner or later getting here. What we have now, I think now it's now, maybe when I'm talking there will be some increase in the number of cases. In Spain we go up to 215, 216 cases. Madrid, it's densely populated, is has the highest number of cases with 70. Follow, I think now, Catalonia. We rank it now second. Yesterday we were third, now we were second. And half of the cases are admitted in the Clínic hospital because we are the reference hospital for infectious disease. This is the beginning. If the epidemic continues and starts increasing, all hospitals are capable of taking care of patients with COVID disease. The places where the Spanish government is looking more carefully because the situation is not so clear at the time being is Madrid, where they have an outbreak related to a hospital in Torrejón de Ardoz. That seems to be not a clear imported cases, and it seems to point out to a local transmission. Certainly there is also another outbreak in Vitoria, another hospital in Vitoria, and I think there is a third one in Valencia related also to some chain of transmission that is not so clear. That will increase in the next weeks. We will find people who has not maybe a clear connection to the imported case, depending on the number of those cases, depending on the contact tracing, depending on lock and the control measures, we will be able to slow down or either control or not the situation. And if the number of cases increase rapidly and we have not been able to find out the contacts and will not be able to follow them, we will probably became in a situation closer to the Italian one. But take into account that Italy, for example, at the time being has heavily precisely located big problems, but the rest of the country, maybe for a time that we don't know how long, is still on the, let's say, a normal situation like we have here. It's the same in Spain, maybe in Madrid, maybe in the Basque Country, there are some more different situations, but still the situation all over the country is what we call a contention phase. We must find, isolate and treat patients and trace back all the contacts of these patients. What the protocol activation, depending on where are you coming from. Nowadays the high-risk countries are China, Iran, South Korea and Singapore, and Italy, the four, at the time being today, the four specific regions. The period of time from the travel is 14 days, the incubation period. Also, there is an additional, let's say, criteria that's very easy to understand. Have you been in contact with a confirmed positive case of COVID disease? That it's a very clear criteria. And if you came from one of these places in the average time of 14 days and you have clinical criteria that are very, very, very mild, and it's not very powerful criteria to define who has this disease or not. For example, we ask only, do you have some fever? Do you have some cough? Do you have a dry cough? Do you have sore throat? Things like that are very, 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 let's say, unspecific. Then we call the public health authorities and they'll probably will release the waiver that we can use for doing the test, and we will confirm or not if the patient is or not a case of COVID disease. Now we let's say, broaden the criteria, and we start testing last week, and yesterday we start a different type of testing. All people admitted in the hospital with severe pneumonia without, let's say, a clear microbiological diagnosis. So people who has a non-diagnosed pneumonia could be tested nowadays for coronavirus. And since yesterday, we start testing also people with mild pneumonia. So everyone with a respiratory disease, a pneumonia, is nowadays tested, and this probably will increase the number of cases, but is what we want in order to make the surveillance at the timing. We want to detect as much as cases as possible in this stage of the outbreak. I will finish with a few comments. There are many open questions. That's absolutely true. We need, to stay alert and see how the epidemic is evolving here, in France, in Italy, and everywhere. We should be very well informed and help, hopefully, to stop rumors and misinformation, that it's very damaging for the confidence of the people. We should always apply the preventive measures and control measures as indicated, and certainly if there is anything that is of utmost importance is the last phrase: hand hygiene, respiratory etiquette, sneezing here and not in your hands, surface cleaning. These are very basic measures at the time being in this epidemic, in the next steps of the epidemic, in the midst of the world's worst pandemic that you can imagine. These are the basic things in order to try, plus many other things maybe, but these are the basic things in order to protect yourself, protect your family, and protect the others. In the current phase in Spain, we are in the containment phase. As I mentioned, detect, isolate, and treat imported cases, if we were able to trace back to an imported case, and surveillance and monitoring of contacts. As I mentioned, this is for influenza. We don't know if COVID disease will behave on the same way, but probably there will be not very many differences. If we have an epidemic of influenza, a regular one without any control measure, there will be a lot of people concentrated in a few times, maybe 4 or 3 weeks, that suffer very severe illness. And that will be very devastating to the system. If we can slow acceleration through this isolation, precautions, hand washing, and so forth, we can go down to this blue curve. And that means that on average, maybe we will have the same number of people, but we will split them in a very much longer period of time, and that will help to reduce the pressure to the health system. Finally, this is another picture from the New York Times. It's supposed that this had been taken in Beijing, and the messages that the Chinese government sent to all the citizens are: the best protection that you can, do not panic, listen to the science, don't spread rumors. They are very powerful messages, very basic things, very clever things to say to people. Try to protect yourself as much as you can. Do not panic. Listen science. Science is imperfect. Sometimes we don't know many things, but it's the only way that we can get real data, analyze them, and believe that something is close to what we call the truth, and do not spread rumors. Finally, nothing spreads like fear. That's a very good film from Steven Soderbergh with an outbreak in the USA, and it's true. And we see this very clearly day to day here in this COVID disease in Spain, and I think all over the world. All the news, all the social media, everyone is talking about different things, rumors and things like that. People is afraid. It is understandable that people had fear at the time. Fear is not bad. Fear can help you to do protective things, to react as much as possible to protect yourself and your loved ones. But if you go a little step forward and enter into panic mode, that will be devastating. You will not listen to the messages, you will do strange things, very strange things that doesn't make sense, and that will not help to control the outbreak. Well, many thanks for your attention. I just finished with a famous phrase of Peter Medawar, who has won the Nobel Prize in medicine back in the 60s. It said, "A virus is always a problem wrapped up in proteins. That's true also for this new coronavirus. Thank you very much, and if you have some questions, I think that Adelaida will take them in. I will try to answer it, or if not, I will say that I have no answer to your questions. Thank you very much.
Thank you very much,
Okay.
Tony.
Sure.
Yes, you can stay there.
Stay there.
Thank you very much, Tony, for this very nice talk. And we have indeed a lot of questions that have been coming in through Twitter and YouTube channels. So we'll try to, I've tried to synthesize some of these questions, which are similar. And so let's start.
You know, Adelaida, this is a long list.
This is a long list. We'll try to.
All right.
Sorry. So Gerard Chalon asks, do we expect a decrease of cases in summertime because of the temperature?
That means if coronavirus had seasonality. Other coronavirus has some seasonality. They usually increase in the autumn and in the winter, and probably in springtime and in the summer there is some tendency to slow down. We believe that it could behave on this particular situation, but we don't have any data to support that. Having said that, this is, let's say, another model that we will taking into account is we have now in the epidemic, maybe in the springtime, in the summer, the epidemic go down, but maybe can go back on the next autumn like the flu. So if we get to the summer without epidemic, that would be fantastic, but it's not 100% assurance that we will not start again, maybe in different conditions, next autumn.
Thank you. Here are a couple of questions on mortality and differences in mortality rate. So, for example, Gustavo Facio Silva asks, why does the outbreak in Washington State, USA, seem to be deadlier than other places? He asks whether this could be a mutation.
I think that the people in the CDC are tracking back with molecular, very sophisticated and powerful tools in order to try to understand what happened in Washington State. It certainly seems that the mortality in this outbreak, that it's a very surprising one, is higher, but I cannot answer if it's higher just only because we don't know if there are many other people infected in Washington State that had not been tested. That will be the much easiest explanation. Usually, at least on average, when a virus mutates, it maybe can mutate and then become a little more lethal or have some complication. But it happens normally on the other way. As soon as a virus starts passing through many thousands or millions of people, usually lose some sort of aggressiveness or contagiousness, and it becomes sometimes milder, but we don't know at the time being.
Okay, and so Joan Vericat says, Italia ha llegado ya a los 100 muertos de unos 4,000 infectados, 2.5% de mortalidad. ¿Por qué este es tan alto si se dice que fuera de China no llega al 1%? Y Aida Santolaya pregunta otra vez si puede ser que sea una cepa más agresiva que la de Wuhan.
La respuesta debería ser, o es parecida a esta. Italia, igual que pasaría aquí en España, al inicio de la epidemia empezó a probar, a testar únicamente los casos más graves. Estos son los que primero van a los hospitales, los que son más fáciles de determinar, y a partir de aquí probablemente las cifras de mortalidad siempre al inicio de una epidemia suelen reflejar, en el numerador están las personas que han fallecido, en el denominador deberían estar todas las personas que están infectadas, pero muchas de estas personas que están infectadas o no las contamos o no las vemos, o al inicio no sabemos cuántas son. Hay que esperar a ver si se ajusta. Por un lado, esto sería la explicación más razonable, cuanto más gente esté infectada, el denominador aumentará y la tasa de mortalidad se irá ajustando, y hay que mirar también, esto se está haciendo simultáneamente, también esta situación de si el virus ha cambiado o no ha cambiado. Hay un tercer factor, que en China no lo tengo tan claro, pero aquí sí, que es que nosotros, Italia, España y otros muchos países, tenemos sociedades muy envejecidas. Aquí hay mucha gente de mucha edad. Por lo tanto, también es posible que este virus afecte a una población que es más numerosa. Promedio de vida en España, la esperanza de vida es casi 83 años. Por lo tanto, aquí también tenemos más personas más mayores que desafortunadamente son las que pueden enfermar, hacer complicaciones graves y quizá morir, como hemos visto, con más frecuencia.
Y hablando de edad, speaking about age, Sonia Tomás asks, do we know why children are less affected by the disease?
The statistics up to now said that very few children get infected. So I think at the beginning of the outbreak in China, that will be something to 2.5%. Then it happens an interesting thing that people is ordered to be quarantined at home, all the family, stay at home for 14 days if there is a case. And then, of course, the number of children infected increased because they are all living in the same house. And it seems now that the average of children infected will be closer to 13%, 13%. Preliminary data. Second, the disease in children seems to be clearly milder. That's a very good news. We don't know if children spreads easily the virus. It doesn't seem to happen this way. It's exactly the opposite with the flu virus. The flu virus also, there are some children with severe flu, but most of the children has a very mild flu and are very extraordinary good spreaders of the flu. It doesn't happen the same with coronavirus as far as we know today. So children get infected in a very low proportion up to now. Second, we don't know if there are spreaders or not. It seems that preliminary data from China suggests that is not the situation, that mostly gets infected from the fathers, not on the other way. And third, and also more important, still with preliminary data, the proportion of children that get severe forms of the disease is very, very low, and the mortality rate, fortunately, is very, very low. But it's not zero. So, like in flu, always there is some children that dies during a flu epidemic in every season, and we have to be prepared that somewhere in Spain, maybe sometime a child dies of this disease. It will happen just statistically. It's very, very low possibility, but it's not zero.
Thank you. Invincible Shang asks, why is the virus not spreading in Africa? At least for now, is Africa free from the coronavirus?
I think you had said the key question, at least for now. We don't know. We don't know if it's spreading on Africa. It seems that there is not severe cases that have been pointed out that could be the tip of the iceberg at the time being. But a couple of things. When WHO speaks about this is #1 public enemy, you have to be prepared, they look on Africa, straightforward. Health systems are very weak. The detection capacities has been improved, but are also still very weak. And there is more than 1 million Chinese workers in Africa. So there will be high chances that the virus has been introduced in Africa. What will happen? We don't know. But certainly, if I was the WHO Director General, I probably will be concerned about Italy, will be concerned about Spain, but certainly I will be heavily concerned about Africa.
Thank you. Sara Yago asks, ¿qué porcentaje de pacientes tiene fiebre?
Al principio las estadísticas decían que quizá un 80-90%. Las estadísticas se han ajustado un poco a la baja y probablemente, aunque proceden de diferentes fuentes, son series algunas más cortas, algunas más largas, en las series más largas se mantienen alrededor del 75%, por ahí. Pero hay series que dicen que hay casi un 30-35% de pacientes que pudieran no tener fiebre. Los casos que hemos visto aquí, que evidentemente son una mini muestra comparado con estas megacifras de China, tenían muy poca o casi ninguna fiebre, décimas de fiebre.
Gracias. PCW Rose asks, again linked to temperatures, she asks if the virulence of the coronavirus would decrease or is temperature dependent?
We don't know. We hope that yes. There are some mathematical models that say no, others say it may be, so we'll have to wait until spring and summer. Remember also that it's not only the virus that changes in the spring and the summer. In the summer, in Spain maybe it's not as, well, it's important also, but we tend to do a more open air life. We open the windows, we walk in the middle of the springtime, in the summer, and in the winter we get to be more closely at home with windows not so very open, it's cold outside. So also it's much likely that a virus spreads in a closed environment like the human normal environment in winter, in cold months, than not in warm months, but we don't know.
Thank you. 2 more questions maybe, or 3?
Couple. Una.
A couple.
The last one.
The last one. Ooh, it's going to be difficult.
No, bueno.
Albert Perlas Puente pregunta, en China parece que ya han pasado el pico epidémico. ¿Eso significa que lo podemos conseguir también en el resto del mundo?
Bien, esta es ha sido casualidad, pero probablemente es la mejor pregunta que nos podían hacer para finalizar el webinar. Vale. China está bajando las cifras, todavía no podemos decir que esté controlando la epidemia, pero parece que la tendencia es claramente a la baja y hay que reconocer, digamos, que esto tiene buena pinta en este sentido. China, son dos Chinas para nosotros en la epidemia, Wuhan y Hubei, donde la situación es muy complicada y también están reduciendo el número de casos, piensen que deberán dar por los, no sé, 60.000 o así, y en el resto de China, o más todavía, en el resto de China hay dos cosas que nos han llamado siempre mucho la atención. Provincias o ciudades con muchos millones de habitantes se han quedado en 1.600, 700 casos. Lo han controlado, es decir, que no entre el virus en una población enorme. Beijing, Guangdong, muchos sitios han conseguido controlar el virus. ¿Pero cómo lo han hecho? Con unas medidas de control y una disciplina que solo se entienden en China, básicamente. Con lo cual los esfuerzos del gobierno chino, la disciplina de sus habitantes, la situación del país, etcétera, han hecho utilizar medidas de una rigidez, de una dureza y de una efectividad hasta ahora parece extraordinaria, que nosotros nos tenemos que plantear si con nuestra vida estable, democrática y tal, si vamos a hacer, que parece lógico, yo prefiero vivir en una sociedad democrática, si me permiten, infectada, que en una sociedad autoritaria que no está infectada, lo siento, es mucho peor para mí una cosa que la otra. Vamos a ser capaces de seguir instrucciones de quédense en casa, aquí no nos van a poner policía, aquí vamos a ser cada uno de nosotros que tiene que asumir, que tiene que contribuir voluntariamente a su salud y a la de los demás. Si prevalece el sentido natural, individualista, de derechos individuales nuestro, va a ser difícil hacer este tipo de medidas de control. Muchas de ellas son imposibles casi de pensar aquí. China además ha utilizado, esto es muy interesante, ya termino, ha utilizado sistemas complejos de inteligencia artificial y sistemas complejos de seguir a sus ciudadanos con el móvil, de manera que cuando se acercaban a algún punto de control sabían si no tenían el virus porque ya habían sido probados, si era alguien que estaba en seguimiento que se movía demasiado y le decían tal, o si no podía entrar porque ya venía de otra zona que estaba infectado. O sea, un seguimiento tremendo, y esto aquí imposible. Premio para los chinos, podemos criticarlos mucho, pero haber controlado esto, un virus respiratorio que es muy difícil de controlar, solo con medidas no farmacológicas, hemos tenido la vacuna, pues encantados, ¿no? Pero solo con medidas farmacológicas, controlar esto en la situación que estaban, si realmente, como parece, se controla, es realmente un hito histórico. A partir de aquí también lo que hemos dicho antes, a lo mejor lo han controlado ahora, llega el verano y en octubre volvemos a empezar, esto tampoco lo sabemos, ¿no? Creo que estamos, ¿no? Bye bye and thank you very much. Is Spanish lunchtime, so we have to go to having lunch at the time being.
Thank you very much, Tony.